Hey guys, it's Dave. Today we're going to talk about glaucoma, which is, outside of eye infections, the most common disease affecting the eyes. It is basically a group of different diseases that all lead to optic nerve damage. And the optic nerve damage then can lead to blindness if it's not treated. It's left untreated, you can develop things over a long period of time, anywhere from 25 to 70 years. It takes to develop them, but slowly, progressively, you will start to lose your vision. The first thing you'll notice is things on the side. The peripheral vision will not be as good, and then there can even be splotches or patches where you will not have vision through your entire normal vision field. There will be patches here and there that will not be there. There are different types. However, the two most common ones are open angle glaucoma and closed angle glaucoma. Open angle glaucoma, basically, it's called a silent thief because over a long period of time, like I said, your vision gradually, without you really noticing it, starts to get worse and worse and worse until you've reached a point where it's too late. With the open angle glaucoma, what happens with that is inside the eye there's a liquid, aqueous humor, that provides nutrients, blood supply to the eye itself, as well as holding the eyeball in its natural shape. Now, the aqueous humor actually goes out of the eye through a meshwork. And what happens in open angle glaucoma is this meshwork becomes impeded as far as being able to go in and out. The aqueous humor is partially blocked. It's not able to do that. And so it increases your intraocular pressure within the eye. It's that pressure, when it becomes increased, causes irritation on the optic nerve. As time goes on, the pressure slowly increases. The optic nerve is not making the adjustments that it normally will, thereby leading to decreased vision and can lead to ultimately blindness if nothing is done. The second most common type of glaucoma out there is closed angle glaucoma. In that one, suddenly you will have the meshwork will be blocked. It won't be partially blocked, it won't be impeded, there will be a block of that. When that occurs, you will see a rapid increase in intraocular pressure. You will see immediate eye pain. You'll have ocular pain immediately. You'll have blurry vision. You will have a decrease in your vision, and you can also have nausea and vomiting that occurs with that. This is a medical emergency if this happens. If you have this happen to you or anyone that you're around, get them to the emergency room right away so they can be treated. Because if you don't get this treated right away, you can lose your vision with that. 80 million people worldwide have glaucoma. The sad thing is only 50% of them know that they have glaucoma. Like I said, it's a silent thief. You don't know you have it until it's too late, which is why it's very important after the age of 40 that you start having yearly visits to your eye doctor so they can check your vision, they can check your intraocular pressure to see how you're doing. Now, your intraocular pressure is a sign that you might be a candidate for glaucoma, but still, in 50% of glaucoma patients, that's not going to show what's actually going on. But it is a good starting point, and they can look at that along with some other things. So if you have any issues in your vision, especially over the age of 40, you need to make a regular visit to your eye doctor so they can keep tabs on that. Symptoms of that, with open angle glaucoma, what you're going to see is basically nothing. You will not see very much until you progress far enough along that in your peripheral vision, you'll start noticing, hey, I'm not able to see things out here like I used to. You may see dots in your vision field as well. or the patches that I talked about where you normally had everything you could see, suddenly this little patch here, this little patch here, I'm not seeing it like I used to. Those are the first signs and symptoms in open angle, but again, that's going to occur later over time, because really, for the most part, you're not going to notice anything, which is why it's so important to go see your eye doctor. Now, in acute closed angle glaucoma, like I said, you will see pain. You will see halos around the lights. You will have red eyes. You will have a headache, nausea and vomiting, which can be very severe with that. And your vision will be decreased, diminished right away. Again, with that, as soon as these symptoms are starting to occur, get to the emergency room right away so they can get treatment started. As far as risk factors, who's at greatest risk for developing glaucoma? Number one, if you're a diabetic, you've really got to watch your blood sugars, you've got to watch your A1C, you've got to stay compliant with your treatment. And you especially need to make sure you're seeing your eye doctor every year, and I would suggest that even younger than the age of 40. Genetics, if you have a family history of glaucoma, you're going to be more prone to it. If you have higher intraocular pressure, you're going to be more prone to it. Again, it's not a guarantee. About 50% of the people that have it will develop glaucoma. Not everybody does. If you have a history of a use of steroids, not only drugs like prednisone, things like that, but if you have steroid use with weightlifting, things like that, you are going to be a prime candidate for glaucoma. African American, Asian American, and Latinos have a higher prevalence of glaucoma than other races as well. As we get older, everybody's risk for glaucoma goes up. So as we progress through life, somebody at the age of 80 is going to be more at greater risk than at the age of 70. Treatments, as far as what we can do. Well, the good news is if treated early, you can slow the progression and even stop it. So that's the good news. There are laser treatments as well as conventional surgery treatments too to help with glaucoma that are more successful now than they've ever been. Those have been around for about 30 years, but as they've gotten more refined, there's less surgery time involved, less recovery time, and better results. As far as drugs, there's prostaglandin analogs. Those are the main first go-to, and those are the newer type ones, thank goodness, because the older ones didn't have as much success. But those are drugs now that are out in generic, which is more good news. But like latanoprost, which is generic Zalatan, travoprost, which is generic Travatan, and bimatoprost, all of those have good results, and generally they're given 1 drop in the affected eye once at night. Some patients will be on it though twice a day. With those, one of the side effects other than eye irritation that you can see is they can change the pigmentation of the iris. Your color of your eyes can change, as well as your eyelashes may grow more rapidly and longer. Another class of drug, which is the oldest class, would be the beta blockers. You're looking at timolol, betaxolol, levobunolol. All of those work by decreasing your intraocular pressure. The third class of drug that's out there is alpha-2 agonists, like brimonidine. Those decrease the pressure as well as increase the outflow of the aqueous humor. So it's working 2 different ways for you. And there are a couple other classes, but the last main class is carbonic anhydrase inhibitors. Those are drugs like dorzalimide, brimonidine, and then acetazolamide, which is oral. Not very common, but I do have a couple of patients on that. Those decrease the secretions of aqueous humor. That's how those actually act. So you do have several choices out there as far as treatments. Your go-to though, like I said, the first one would be the prostaglandin analogs, and those mainly work by decreasing the pressure as well. Thank goodness, like I said, they are generic and they are easier to use because you can get away with just doing them once a day. But the big takeaway from all this is after the age of 40, especially if you're a diabetic, especially if you have a family history, get in to see your eye doctor so you can get things checked out. The earlier you find out you have glaucoma, the better the outcome for treatment.